From Eyewitness News, this is Newsmakers.
Welcome to Newsmakers. I'm Tim White. Ted Nesi will join me on the second half. Normally competitors with a tense relationship, to say the least. The two main hospital groups in the state, that's Lifespan, which owns Rhode Island, Miriam, Bradley, and Newport Hospital, as well as Care New England, think Kent Hospital, and Women and Infants in Providence. They are coming together in this time of crisis to serve the state. On Wednesday, I spoke with Dr. Tim Babineau of Lifespan and Dr. James Finale of Care New England via Skype. Dr. Babineau, thank you very much for joining us, and thanks too as well to Dr. Finale, who's going to be joining us in just a little bit. And we're trying to practice what we preach by doing an interview via Skype. Let me start with a question about your preparedness at Lifespan, Dr. Babineau, and if my numbers are wrong, correct them. 60 ICU beds, 200 ventilators that you have over there. Just down the road in New York, the governor is begging the federal government to send more ventilators his way. What is your confidence level that your infrastructure at Lifespan can sustain a massive influx of patients like we're seeing in Italy?
Yeah, thanks, Tim. Good to be with you, and I appreciate the opportunity to come on. As I mentioned earlier today, we've been preparing for this pandemic for several weeks and a couple of months. Right now, as I sit here today, we're in pretty good shape. The numbers that are coming into our ER and inpatient are really rising very, very slowly. The hospitals are actually fairly empty. Our volumes are down 30–40%. So right now, we have plenty of capacity. We only have a couple people in intensive care, and I believe as of about an hour ago, only 2 that required ventilators. So your numbers are correct. We have roughly 200 ventilators, about close to 100 ICU beds. We, learning from others, have already explored technology where if we had to, we might be able to put 2 patients on 1 ventilator. So theoretically, haven't done it, we could ventilate 400 people. Tim, at that point, my opinion is it doesn't become an equipment issue, it becomes a staffing issue. These are very highly specialized people who need to take care of the folks on the ventilator. So right now, we're as prepared as we can be. We have plenty of capacity when it comes to ventilators and ICUs. We have plenty of capacity when it comes to our fantastic healthcare workers. What's coming down the pike is anyone's guess. I think we are slowing the spread here in Rhode Island. So right now, we're in a good place.
Last week, we reported that healthcare workers had to wear the N95 masks for longer than recommended, multiple days, because supplies are running low. Are you still in that mode right now?
We are, and again, we're in uncharted waters, and we're using our best judgment every single day to do what's in the best interest of our workforce and our patients. So we're doing things that, quite frankly, haven't been done before. We are using N95 respirators for 1 and 2 and 3 days if they're not soiled, if they're in good shape, and that seems to be working fine. In the old days, you'd wear it for an hour, you'd throw it away. We can't afford to do that anymore. So right now, our personal protective equipment stock supplies are pretty good and will be for a couple weeks. But we need to make sure the supply chain stays open, because we will run out unless we get restocked.
And when do you know when you'll run out? When we're talking not just the masks, we're talking gloves, we're talking the full body garb. Do you have a clock on when those supplies run out on you?
Yeah, we do, and it depends on what you're talking about. The one that is in the shorter supply, N95s, we have at least a couple more weeks of that. Part of that, however, depends on what we refer to as the burn rate, which is how many you use in a day. And as we see more patients, we'll use more equipment. But right now, we're in pretty good shape, but we need to make sure that the supply chains stay open and get us what we need, and so far they have.
Have you talked directly, and when I say directly, I mean, in a mass memo or video to your staff recently, and what have you told them?
Yeah, thanks, Tim. I have a couple times. I sent out a video email last week thanking them, reassuring them, thanking them for their heroic efforts. I just taped another one not 20 minutes ago that will get posted online later today. So I'm doing the best I can to communicate with our frontline staff. And again, I can't emphasize enough how enormously proud I am. And I know Dr. Finale feels exactly the same way.
Dr. Babineau, hospital workers at Lifespan, as you know, have been diagnosed with COVID-19, and on social media, there have been people who have been at Rhode Island Hospital, been at Hasbro, and they're concerned they may have been exposed by one of your healthcare workers that have later been diagnosed. What do you say to them?
Yeah, as we reported this morning, we have a handful of healthcare workers at Lifespan who have tested COVID positive. And if you think about it, Tim, that's not surprising, since at least in the last couple of weeks, the only people who are getting tested were the ones that either the Department of Health approved or were a healthcare worker. So there's a predominance of healthcare workers being tested, and appropriately so. So we have about a handful of folks right now. We don't know whether they picked it up at work or they picked it up in the community. Thankfully, they're all home. They're all doing reasonably well. None have required hospitalization. And when we believe that a healthcare worker may have been infected while at work, and there's only been 1 or 2 cases, we've done contact tracings of the people they've come in contact with.
Are we testing enough people, and should the criteria of who we test be loosened?
We're not testing enough people, but it doesn't have anything to do with the criteria. It has to do with the availability of the test kits. We have been enormously frustrated, and I know the governor is frustrated, and Dr. Alexander Scott is frustrated, and we talk daily, 2-3 times a day, about, for whatever reason, Rhode Island's inability to get sufficient test kits and test materials. We should be able to test a couple hundred people a day. We've only been able to test 40 or 50 a day. Now, I got a little bit of good news about an hour ago that there's a new test that was just approved for emergency use, a technology by a company called Cepheid, C-E-F-E-I-D. We have the machines here. We've got 3 of the machines. We need the cartridges. We need the things to put the samples in to put in the machines. And we hope that we will be getting a big shipment of those cartridges in the next day or 2. If that's the case, we should be able to ramp up our testing dramatically.
Do you have an idea of how much ramping up you'll be able to do? How many more tests? You're doing 40 to 50 a day at Lifespan. How many more do you think you might be able to do?
We should be able to do a couple 100 to 300 a day if we get the kits.
And we should point out, many people might be watching this interview later in the week. We are recording this interview on a Wednesday, so that changes the time frame. How quickly do the results come back, Dr. Babineau, when somebody gets tested with this different method?
Yeah, great question, Tim. That's the great news. It's a very rapid turnaround. 45 minutes.
Wow.
45 minutes. And it's called point of care testing, so it can be rapid, high throughput. So we're hoping we get the cartridges. Literally, the FDA just cleared this machine for this particular use 4 or 5 days ago. I know the company has ramped up their production of the cartridges. I've been in touch with the company's CEO on almost a daily basis, and we're hoping we'll get some material in the next day or 2. There are other tests available as well, and we're trying to get those test kits as well, but we're particularly hopeful that this one will come through in the next day or 2.
Dr. Babineau, earlier today you said you believe the state is flattening the curve. Was that an anecdotal assessment, or have you talked to epidemiologists about how the state is doing?
It was my own personal feeling based on what I'm seeing here at Lifespan. I check the numbers 3 times a day. Every 8 hours, we get an update on the number of inpatients that have tested positive, and it's been a very, very slow rise. Now, all bets could be off a week from now, 2 weeks from now. That's one of the challenges about this virus, is we don't have a full profile on its behavior. We're learning as we go. So right now we look good. 2 weeks from now, it's anyone's guess. But right now, the rise has been slow enough where I think you could infer the very aggressive social distancing policies that the governor put in place. And kudos to the governor. She's been amazing, and Dr. Alexander Scott has been amazing. I think those efforts right now are paying off.
And finally, I'm about to talk to, as you know, Dr. Finale. You both made it a point today to do this interview together, which we appreciate. We're trying to get as much information out there as possible. But as we look ahead, as we look beyond better days when we're through this crisis, should we be reading into this at all, this new togetherness that we're sensing between Care New England and Lifespan, considering all the turmoil that we've seen for the past couple of years?
Yeah, I wouldn't read too much into it, other than Dr. Finale and I and all the hospitals are deeply committed to doing what's right, and what's past is past. I talk to him almost every single day since this crisis hit. We're working incredibly well together. We have exactly the same priorities, exactly the same goals. The past is the past, and who knows, maybe there'll be a silver lining in all this. Who knows?
Dr. Babineau, thank you very much for your time and good luck over there.
Thanks so much.
So, Dr. Finale, thank you for joining me. We just, as you know, we just spoke with Dr. Babineau. Both of you are doing this joint interview, and we greatly appreciate it. Dr. Babineau, optimistic on the level of preparedness when it comes to lifespan and the number of beds that they have and the number of ventilators. Cannot predict the future, of course, but right now, as things stand, he feels pretty good about it. How about you? Are you feeling that when it comes to beds and ventilators specifically, the ability to care for those who are very sick, that you're in good shape?
Yeah, again, we don't know what the future holds. We don't know how many patients might be affected, but we're principally looking at Kent right now, so our availability and our ability to staff up and expand the ICU is significant. Also, if push comes to shove, we're also working on trying to have ventilator ability at women and infants. So I feel as strongly as he does. We talked this morning that we're as prepared as we can be. Nobody knows what's coming, but we're certainly as prepared as we can be.
How about preparedness for your frontline healthcare workers? We reported last week that hospitals are asking the healthcare workers to use the N95 masks for multiple days. Are you still in that mode right now?
Yeah, every day it seems to evolve and change. We're probably going to universal masks today. The availability of PPE, as you know, the new term, is limited. We are using a lot of masks, trying to make sure that if our staff, we call it source control, if our staff is potentially affected, we don't want them giving it to our patients. So we're worried about the supply. We're doing everything we can to maintain that supply, but we're masking everybody today.
Dr. Finale, I'm sure you've heard it. We get a ton of emails on it here at Channel 12 and in our social media. Calls to reopen Memorial Hospital amid concerns that we could have this tidal wave of patients. Is that even on the table for you?
That's a complex question, but let me answer it the following way. One is, currently, as Dr. Babineau probably said, is we've got capacity, we've got hospital beds. The hospitals are 30, 40, 50% empty, so I think we're well prepared to handle just about any surge. That said, I think the state emergency preparedness folks have to look at all options. I haven't specifically spoken at length with anybody about the potential for Memorial. I know people were looking at it today. Memorial, as a building, has some significant challenges to be able to open up in this kind of condition. And could they get it ready in 4 to 5 weeks' time for when this surge may or may not happen? The question is, when's the surge going to happen? Is it going to happen? If they need the beds, how long would it take to take a building that's been closed for 2.5 years with no water running through the pipes, with no air conditioning? How do you get that up and running, especially with staff? So the answer is, I think everything has to be looked at, but we haven't spent a lot of time talking to folks who we haven't been officially approached.
Yeah, we know the EMA, National Guard, have been over at the Dunk. Yeah. They've been at the Convention Center. They've been down the Ryan Center. It sounds like, from their perspective, they haven't reached out to you about Memorial just yet.
They visited Memorial today.
Okay.
I know. I believe that's who visited the Memorial today. So they were there today. We haven't heard from them since they came back today.
I want you to put on your doctor hat here, Dr. Finale. A lot of people may be getting their hopes up when they hear the president talk about chloroquine and another drug to help potentially treat the disease. What is your understanding about the efficacy of those drugs?
I'm going to take Dr. Fauci's statement and say, as a scientist, and I think all of us are to a certain extent, there's no definitive data that this works. So I don't want people to get their hopes up yet. I know there's testing going on to see if the combination of the antibiotic and chloroquine work. Remember, chloroquine's a medicine that a lot of our patients take now, and if people start hoarding it because they think it might work, the people that need it are not going to get it. That medicine is used for other diseases like rheumatoid arthritis and other things. We'd hate to have those people affected and not have a supply of that medicine which they rely on for the treatment of their disease. So science not proven. Be nice if it did. Don't know.
All right, final question for you, Dr. Finale. It's not lost on me that both you and Dr. Babineau are doing these interviews together. It's been a couple of years of turmoil, I think, to put it lightly, between the two organizations. Should we be reading into this joint interview at all, and the joint interviews you've been doing during this crisis? Could there be maybe a new day ahead after we get through this crisis?
I think you should read into it that despite competition and differences or whatever they are in the past, we can work together as the two largest health systems in the state and really do what's best for the state of Rhode Island, and that's what we're doing.
All right, Dr. Finale, thank you for your time and best of luck through this.
Thanks so much.
Again, that interview was recorded on Wednesday. When we come back, we go live to the State House and we talk to my colleague and Eyewitness News politics editor Ted Nesi, the politics of a pandemic and how reporters have adapted in covering this crisis. Stay with us. You're watching Newsmakers. Welcome back to Newsmakers. I'm Tim White. We now go live to the Rhode Island State House where my colleague and Eyewitness News politics editor Ted Nesi is standing by. Ted, we talk every day, but it's good to actually see you, I guess, sort of in person here.
Yeah, it's our version of social distancing, Tim.
That's right, by several miles. All right, I want to start this conversation with an article that you filed Thursday night. You and I are talking here on a Friday morning, and I'll go right to a tweet that you put out because I think it summarizes it nicely. And you wrote, "The economic damage caused by coronavirus is worse in Rhode Island than in any other state, at least by one metric. 6.4% of Rhode Island workers filed for jobless benefits last week, the highest share in the country. Governor Raimondo says the situation is devastating." Ted, why does Rhode Island have the highest share in the country? Is that because the state shut things down a lot earlier than maybe other states did?
Yeah, I think there's a few reasons for that, Tim. I think the governor has taken aggressive action. The restaurant closures and the understanding that this was serious, that was made clear from officials pretty quickly in Rhode Island, which I think led some businesses to voluntarily shut down, maybe even more than they were being directly ordered to. I also think, we know a big part of Rhode Island's economy is food, hospitality. The hotels are empty. The two big casinos, they are closed indefinitely right now. All of those have a huge number of jobs attached to it. But I mean, it's just, I'm trying to get across to people how astonished I am still as these numbers come out. I was a young reporter at Providence Business News during the Great Recession. It was my second year as a reporter. And I remember when Governor Kucheri announced that the unemployment rate was going to, I think, 12%, and thinking, wow, I will never see anything like this again in my lifetime. What an extraordinary time. Right now, it looks like the unemployment rate's on track in Rhode Island to hit maybe 15% or more when the numbers for March come out in April, just because so many people out of work. So it's just, it's like nothing we've ever seen before, because the Great Depression, the Great Recession, those were terrible but built over time. This has happened in a few weeks.
Well, does that, as a business reporter, I'm not asking you to predict the future so much here, but does anything feel, besides the immediacy, the quickness of this recession, does anything feel different for you now than it did, say, in 2008 that might be an actual positive indicator that maybe Rhode Island and the country could possibly bounce back once this virus is contained, is under control?
Well, I think one slight positive maybe about how fast and severe this has been is it seems like most people are on the same page about what a catastrophe this is. You look at Washington passing a $2 trillion stimulus unanimously in the Senate. As we recall, the Obama stimulus was basically along party lines. There was division there. This time, no one's disagreeing. So it could be that there'll be more unity around the necessary responses. But I got to say, the problem is that the damage compounds. So a restaurant closed for 1 week is very hard for them, hard for the workers. But if they reopen the next week, maybe extra people come in, that's one thing. If you're closed for 2 weeks, if you're closed for 3 weeks, a lot of these small businesses don't have a lot of extra reserves, extra capital. They're laying off or at least furloughing their workers so they can collect because they can't pay them. How long does that last? And the damage can get worse and worse as families pull back. So my concern is just we have no idea how long these aggressive, maybe you could say draconian shutdown measures are necessary. And I just think the longer it goes, the more you can't just flip a switch and go back to where we were at late February.
Yeah, one metric we might be looking for here, Ted, as we go on through the months is bankruptcy filings in federal court. Look, this is a tricky call for governors when we talk about the economy, Ted, across the country, not just here in Rhode Island, trying to balance the health and safety of the public with the economy. And the Governor Raimondo here has chosen the former and has been aggressive in trying to keep the virus from spreading. Not all governors are doing that. What is behind her decision making here?
Well, I think you heard it from the hospital executives you interviewed on the first half of the show, Tim. I think there was just a quick realization. You know, it might have helped if this is as bad as the doctors fear it could be. I mean, look at New York right now or Italy. Right. It might have helped Rhode Island that there was that relatively isolated initial case from St. Ray's fairly early in that was in February we learned about that. And having that situation develop somewhat sooner, I think, woke up officials in Rhode Island faster than in some other places to the seriousness of this. And it does seem right now, I am not predicting next week could be terrible for the hospitals if the number of cases pick up, and I don't want to give people any kind of false hope. On the other hand, I will say, even getting through now another week with the hospitals not overrun, with the number of hospitalizations rising but not super quickly, at this hour we have no deaths in Rhode Island from COVID-19. If those aggressive actions have flattened the curve or even just spread out how long it takes for the virus to spread in Rhode Island, that could be very useful time. And I think that was the calculus by the governor and her aides, just that they did not want, they were very worried about the healthcare system getting overrun. They are also extremely worried about the economic damage that's happening, but I think they feel that there are ways to fix the economic damage, especially with help from the feds, and it's much harder to suddenly fix overrun hospitals that are out of ventilators for people gasping for breath, you know, because they have COVID-19. I think that was the calculus.
A lot can happen, but we are midway through the governor's final term. Ted, when you think about writing the governor's, you know, the story about Governor Gina Raimondo on her last day in office, you have to think her approach, her decision making during this crisis is going to be in the first 2 paragraphs.
Yeah, you know, if I say Governor Garrahy to you, what do you think? The flannel shirt, blizzard of 78,
the blizzard, right?
He served for, yeah, exactly. He served for, I believe, 6 years after the blizzard of 78. But in memory, you know, the time he bonded the most with Rhode Islanders, and the thing that is the most burned into people's memory of his governorship was his leadership in a crisis. And that is often the case. With President Bush, we think of after 9/11, we also think of Hurricane Katrina. Franklin Roosevelt, you think of the speech he gave after Pearl Harbor. You know, and I think this is, it's so disruptive to society. I think every governor, not just Governor Raimondo, is going to be remembered for how they handled this. And, you know, whether people felt confident, whether people agreed with them, and also just whether people felt they took it seriously. So I think, yeah, this shows you know, we never know what's coming. I think you don't know what the rest of her term will bring. We hope this is all over or you know, not as dominant in our lives before too long, but we don't know that. And so I think this now has become a very important part of her legacy. How has she so far, and does she continue to guide Rhode Island through really an unprecedented crisis that's hitting the whole world simultaneously?
Let's look in the mirror here, if we can, and just look at the impact on journalism. And you're at the State House right now, not just because we're going to practice social distancing, but, you know, on a Friday morning, you're going to be live at noon on Channel 12, then you're going to be covering the governor's press conference at 1 o'clock, then you're going to be live again at 5, 6, 6, so on and so forth. You know, the way we ask questions of the governor, I think people realize at home, maybe not, is we have to do it remotely. We submit a question to the governor online, and then it's asked by a third party. Ted, putting on your journalism professor hat, what are the obvious challenges to that method of journalism, of news gathering?
Well, it's not ideal, right, Tim? I mean, you can't, first and foremost, you can't ask a follow-up. You know, so you ask a question, maybe you don't quite get the answer you're looking for, you'd like something more specific. You can't just jump in like we do in a normal press conference and say, but are you saying, you know, XYZ there or this? It's also just strange. You know, I got to the State House today, as you said, it's Friday morning when we're taping this, and for the first time, my photographer, Corey, and I were actually stopped by uniformed personnel trying to walk in, and we had to be interviewed about our health to get into the State House. You know, do you have any of these symptoms of COVID-19? Have you been with anyone who has COVID-19? That's brand new today, Friday. You know, yesterday we did the press conference after the big borrowing meeting, and we were all, you know, at a big distance. We have microphones set up in the middle, so it's made it harder, certainly, or it certainly disrupted our normal ways of doing things. But I think, you know, I think reporters, and you know this, reporters are trying our best to balance what is a real public safety emergency right now with still advocating for our ability to get to people making news, you know, do things like the hospital exec Skype interviews that you did, so that we can get the information people need. But it's undoubtedly harder.
Yeah, and usually the State House right now is, well, maybe not in the morning, but later will be bustling with people as we're in the General Assembly session. It just is sort of an eerie thing. Ted Nesi, thank you so much for joining me live from the State House. And if at home you didn't catch it and you're wondering about the stimulus bill that just came out, Ted has the article you need to read on WPRI.com. Everything you need to know about the stimulus bill and what you might be eligible for. Again, that's on WPRI.com. And that is the trusted source for this coronavirus coverage. Make sure you follow us on Channel 12. We are carrying all the press conferences live, both on WPRI.com and here on Channel 12. For everyone here at Eyewitness News, thank you for watching, and we will see you next week on Newsmakers.